our question about what to expect with pregnancy. Pat Cahill from the Children's Hospital of Philadelphia is going to talk to us a little bit about some work he's been doing around this topic. Pat?
Great, thanks, Peter.
You want to keep that or use that? Whatever.
I'll use this one.
Okay.
So yeah, thanks, Lindsay. That's a tough act to follow, and also to the panelists. You guys are really the heroes of today. I mean, you have done what all of us are trying to do, which is to conquer scoliosis. So thanks for sharing your stories and kind of inspiring those of us that work in this area to keep going. And so again, thank you. And hopefully, Lindsay, to answer your question about pregnancy and childbirth, I'm going to try and address that topic right now. AIS is a really common condition. It's probably more common than some of the other things that your friends have, like asthma. And it's something that is probably close to equally common in boys and girls, but when it gets severe enough to need surgery, it's much, much more common in girls. So it's really important that we talk about what it means to have scoliosis surgery and then have babies later on in life. And as Eve and Courtney talked about, kind of when you first hear that you need scoliosis surgery, it's sort of a gut punch. It's an emotional reaction. Sort of the second wave is to think about what it means to get through that episode of surgery. And then kind of the third phase of that process is to think about what's going to happen long term in the rest of your life. And a big part of that is having babies and being pregnant and things like that. So the questions we get a lot from families and girls that are thinking about scoliosis surgery and particularly surrounding pregnancy are, will my pregnancy be more difficult? Will I have more pain? Will I be able to get an epidural if I would like to? Will becoming pregnant make my scoliosis worse? Things like that. And so the members of Setting Scoliosis Straight have tried to answer this in some ways in the past. Dr. Betts, who's not here, but one of the founding members of our consortium, has addressed this in probably the largest series. And what he found is those patients that had a spine fusion did not seem to be at any increased risk of having back pain during their pregnancy, and it didn't seem to be something that predisposed them to needing a cesarean section. So that's pretty good information. Also, we saw earlier today that there's a lot of great long-term evidence from Scandinavia because they have these national medical databases, and what they found is that maybe they did have a little bit higher back pain during pregnancy, but not an increased rate of cesarean sections, but they had an increased risk of vacuum extraction, which is basically something that if you need a little bit of help to get the baby out. Another study showed that the curves below where a scoliosis fusion occurred did not seem to get worse after pregnancy. So that's all good news. The problem is that a lot of this information is from old-fashioned instrumentation. So Dr. Errico talked about the evolution of different instrumentation systems, and most of these papers were on something called Harrington rods, which is kind of like 3 generations ago of spine instrumentation. And none of them talked about what is life like, kind of your overall health and well-being if you've had scoliosis surgery and you're pregnant. So we now have questionnaires that answer those questions, and they've just never been applied in the pregnancy phase of life. So this group, the Harn Study Group, which is the research arm of Setting Scoliosis Straight, is probably the best group that's positioned to answer these questions. We have a lot of patients that have had scoliosis surgery. We've had you fill out these questionnaires, and you've had surgeries with the modern instrumentation. So I think we're in a good place to do that. So we've started to try to answer some of these questions, and we've tried to answer kind of 2 big groups of questions. What is the effect of scoliosis on your pregnancy? Does it make pregnancy harder or riskier, things like that? And then what is the effect of pregnancy on your scoliosis, sort of the inverse? And does it make your scoliosis get worse if you get pregnant? And so what we've tried to do is identify those patients that have had been captured in our database who've filled out the questionnaires before, during, and after the surgery that have then gone on to have children, and try to get them to complete questionnaires about their pregnancy. And this is a questionnaire. It's pretty quick and easy to fill out. It takes about 10 to 15 minutes, and it gives us a lot of really good information. And rather than going through a lot of the statistics, what I'll tell you is I'll try and summarize things. We've had a small number of respondents thus far, just a little bit more than 20 patients, but it seems like so far that the average number of children is pretty consistent with what's happening elsewhere in the United States, that there's no increased risk of prematurity when we compare it to national averages, that the type of anesthesia, this is one area where our data is showing that there may be some need for improvement. It looks like maybe patients that have had idiopathic scoliosis surgery are less likely to get epidurals and less likely to get spinal anesthesia. And this is something we think is an area that we can help educate our scoliosis patients on so that they can get the kind of care that they want. And this is another statistic that was a little bit alarming, that the rate of C-section with the first pregnancy seems to be a little bit higher in women that have had scoliosis surgery. And it's probably just because of obstetricians being uncomfortable and unsure about what to expect with patients with previous scoliosis fusions. Almost 2/3 of the patients, or a little bit more than half, the obstetrician just said, we're going to do a C-section just because, and didn't really give much other explanation. But what we know nationally is that the vast majority, 93-95% of women would rather not have a C-section and prefer a spontaneous vaginal delivery. And so this is the area that we think a little bit of education and planning on the part of patients in collaboration with their scoliosis doctors and obstetricians can improve. Let's fast forward to some of the other things that we found. Patients experienced some kind of leg pain and cramping and a little bit of numbness in their legs after the delivery, but those seem to be short-lived, and they got better with a little bit of short-term pain medication. Abdominal binders were really nice for the scoliosis patients, which is just kind of a Velcro vest around the abdominal area to help support things. Other things we found is that the babies were healthy and normal after the delivery. All but one of them were normal in this group of 20 pregnancies that we were able to study, and that one seemed to have nothing to do with the scoliosis, but rather was a rare genetic issue. So some of the recommendations we have for those of you that have had a scoliosis fusion is to kind of keep this checklist in your medical record somewhere and in the back of your mind, is to keep a copy of your x-rays. Ask your doctor to burn a CD for you that you can keep somewhere safe, so that not only if you're going to have a pregnancy or delivery later on, but if you get into a car accident and they see some x-rays in the emergency room and they're not sure what they're looking at, they can have sort of a baseline to compare against. Mind your T's and L's. So Lindsay was very good. She knew what her lowest level of fusion was, and I would challenge all of you to make sure you know that as well. So the thoracic spine is this area of your spine where there's ribs attached to it, and the lumbar spine is the lower area. And this is important because the anesthesiologists during your delivery, if they're going to do an epidural or a spinal anesthetic, they like to place it in the lower lumbar spine. So they're going to need to know which level your fusion goes down to so that they can place that epidural below that. And then choose an obstetrical team that's capable of caring for scoliosis mothers to be. And that means the obstetrician, but also the anesthesiologist that those obstetricians work with. And these are some important questions I think you should ask your team. So ask your obstetrician, have you had mothers with a previous spine fusion for scoliosis? And you have to make sure that they can differentiate between a spine surgery for disc herniation or degenerative problems, or those for scoliosis, and then ask if they approach their care in a different way than other patients, and then ask them specifically about their anesthetic team, if their anesthetic team is comfortable with these conditions, and if the anesthetic team is willing to work with you on your preferred method of delivery and your preferred method of anesthesia during that delivery. And then I would even recommend that you meet with the anesthesia team ahead of time, show them your x-rays, make sure that they're comfortable with being able to try to place an epidural or a spinal anesthetic if that's something that you want to do. And then lastly, your scoliosis surgeon is a resource for this process. We'd be willing to talk to your obstetrician to assure them that having spinal and epidural anesthesia is a safe and reasonable thing to do. And all of your scoliosis surgeons, and I know I do as well, have a partner obstetrician in my city that if somebody calls me, I send them to that doctor because I know that they're going to be able to take care of patients that have had a spine fusion and do it in a safe way that meets with their preferences. And lastly, we love hearing from you and we love getting baby pictures, so please keep us in the loop.
Great, thanks a lot.
Oh, one more point. And once the baby comes, there is a slight genetic predisposition for your babies to have scoliosis, so make sure that their pediatrician is aware of it and looking for it throughout their lives as well. Thanks.
Great. Thanks very much.